traditionally, care for patients with long-term conditions have been hospital-based. Partly due to the advances in technology, many patients can now receive their care in a more convenient environment within the community, such as health centres or even in their own homes. In Southampton, patients living with long-term conditions that need regular monitoring are now offered peace of mind and convenience.
The technology side of treating patients has changed enormously, both in terms of the scope of the interventions we can do in cardiology and also in terms of the way in which we can manage patients outside in the community.
I have an electrical problem with my heart, so what I've had to resolve that problem and to monitor it is an ICD fitted into my chest.
We are now able to check on the functionality of those devices remotely without the patient needing to come to hospital. So, low pace burden, so that's good.
I can plug into the telephone line and send the data from my ICD to Southampton Hospital. It's easy to do, it gives you peace of mind. Environmentally it's good because you're not having to travel anywhere. It's about an hour and a little bit each way that it saves me.
Much more importantly, and of greater potential for the future, is that in those same implanted devices there are lots of clever technologies that tell us things about the patient's disease and disease process. And the information we get from those devices will allow us to preemptively prevent deterioration in patients' conditions by changing treatments before they become more unwell. So in that way we can use primary care to manage these patients more efficiently, and many of them will never trigger patient admissions. A simple message for the future is that innovation and technology are our friends and not our enemies. We need to get away from the concept of lots of real estate. There is a need for very good information technology and taking things closer to the patient and closer to the community care facilities.
Now let's look at another example. In Nottingham, a new scheme is transforming patients' lives by bringing care closer to their homes.
The problems when we started off here was integrating chronic obstructive pulmonary disease so much that patients could have access to all of the services in one site within their local community. Fortunately, we had community hospitals which we utilised, and then it was organisationally trying to get everybody to use this facility.
We've broken down barriers and we work as a team, so it's both primary care and secondary care working together.
I think the patient gets the benefit because it's easy access and they get more of a one-stop shop.
Patients access this service much more readily and easily than they would have done if it had stayed centralised in secondary care.
I don't have to travel far to come here. The environment's much better, more friendly. You come in and look after you straight away as soon as you walk in.
Where we see there's a need for oxygen in that patient, they're referred directly onto the oxygen assessment service, and that's kind of a double hit for them in that they've got oxygen to support them exercising, and we're giving them proper support and proper exercise programs for them to increase their fitness.
Half the patients double their exercise performance.
They receive skills in self-management and they're much more knowledgeable about their disease, so they're a much more informed patient. So when they go and see the doctor, they can be much more proactive in their own care.
Before, I couldn't walk very far, probably 30, 40 yards. Been on the rehab scheme, you know, doing exercises in the gym and whatever. That helps quite a lot.
Patients understand what the therapy can do for them and they understand how to use it properly, and that's never really happened before.
If I'd not been here, I don't know what state I would have been in now if I'd not come here or been on oxygen.